It's a pleasure for me now to talk with you about connected solutions of the Freestyle Libre 2 system and the Novo Pen. Maybe you have recognized that now it's not more usable or common that you have to scan the sensor every 8 hours in order not to lose any CGM data. It gets directly streamed with the Libre 2 system as it does with the Libre 3, but also the Libre 2 can do that. And it's updated every minute. And via the Libre Link app, it can be shared with the people's relatives, but with the Libre View, also with the healthcare professionals. But still, people living with diabetes have the opportunity to scan the sensor in case Bluetooth is interrupted. A further novel innovation is the integration of pen data to the Libre app of the smart insulin pen NovoPen 6 and Echo Plus. Just with scanning the pen, the data of the insulin injections get merged to the CGM data and people can review the impact of the injections on their glucose levels. And it's very easy to do that. You just have to connect the pens. You can save more than one pen and add the information which insulin is inside. And then the system knows the pen, and every time you scan it, you can review it. You don't have to scan the pen every time you inject it. The pens can save up to 800 insulin dosages. But it's recommended to do it at least once a week because then the scanning time is quite short. People can review it in the Libre app, but they can share it also with the healthcare professional in order to improve their insulin management. And that's what I do with the people with diabetes I take care of. And I thought it's easy for you to get into this technology by sharing my experience with this technology with you. This is a 79-year-old woman living with type 2 diabetes since more than 15 years. She had a very early initiation of insulin therapy. Type 1 diabetes was ruled out. She has a BMI of 18 because she's very strict with eating and uses multiple daily injections with insulin degludec and insulin aspart. And on the right side, you can see on a normal day, she injects 14 units of insulin degludec and around 10 units of fast-acting insulin aspart. With that, she has a time in range of 74% and a time below range of 1% and no evidence of glycemic variability. Maybe some of you will ask why such an elderly woman has such a tight glycemic control and such a fancy insulin therapy. But actually, I think that age shouldn't be a limit for good therapy. And actually, this 79-year-old woman is still running a huge company as a CEO, and she wants to do her insulin management as best as she can alone. And she just needs me at the background when she cannot do it alone anymore. So on the 9th of June, she called me saying, Doctor, my glucose is high. Might it be related to the current antibiotics I'm taking as a prevention after tooth extraction? And if people calling me because they have a problem, what did I do? I go to the Libre View and check the days before the call. And that's what I want you to do now as well. Grab your phones, scan the code, and help me answering the question. Do you think what might be the reason for the hyperglycemic excursion in this lady with normally good glycemic control? Do you think she has a current infection after the tooth extraction? She has pain-related hyperglycemia. She missed bolus injections or she missed basal injections. Please vote now. Okay, thanks. Can we get it? Yeah, thank you. Maybe this was a little bit difficult. You really have to go to every day, and then you see that you missed two basal injections. And if I was telling her that, she didn't believe me. But she knows that I see everything because she knows that her pens are connected with me. And you see, on the other days, she injects both insulin at the same time. And maybe people also tell you this. Sometimes they cannot remember whether they injected the insulin some minutes before. So what we did in this situation, I was just recommending her, maybe the next time, please check both of your pens if you have injected your insulin. So you see, it's very easy. She just forget the bonus, but it's a basal. But I think it's important because what would we have done before? Before I would have had this information, I would just have increased the insulin without thinking what I'm doing. So I think we get into a novel situations because we see that with the data we have from the smart insulin pens. And I want to show you here a study in people living with type 1 diabetes, which showed that the estimated probability of missing at least one basal insulin dose in a given 14-day period is 22%. So it's quite high. And that's keep in mind when you see hyperglycemic excursion that maybe the insulin was not injected. Let me show you another woman living with type 1 diabetes since her first 12th birthday. She has a BMI of 32 kilogram per square meter, and despite the long diabetes duration and the fact that she is obese, she has a really low insulin demand with using insulin degludec, just 11 units per day, and 1 unit per 30 gram carbohydrates of insulin aspart. With that, she has quite good glycemic control with an HbA1c around 7%. Here on the right side, you see the glucose daily logs before her routine visit. And at this routine visit, she complained about recurrent hypoglycemic episodes and wants to decrease the basal insulin dose. So please, could you please help me again? Grab your phones, scan the QR code, and suggest, what do you think? Do you think that these hypos you see here are related to a too high basal insulin dose? Yes? No? You have no idea? Or you say with an HbA1c of 7, never change a winning team. Excellent. I think we can stop the voting. You all did right. Yeah. That's a frequent finding with these since we have the smart pen data. The hypos are following correction doses. And since we observe that so often, we wanted to look at this data and we made a study investigating more than 18,000 people with type 1 and type 2 diabetes who were on CGM and were starting smart pens. And what we found was that the estimated rate of correction doses followed by hypoglycemia were around 9%, especially in the younger patients aged 18 to 29 years. It decreases with increasing age, but the good news is it also decreases with the implementation of smart pens. If you're more interested in this data, they are presented at this meeting as an e-poster reviewing number 464. Here's my last case, and I already presented this case 2 years ago at the ESD meeting, and so many of you came to me and say, wow, that's an interesting case, how it will develop, because the woman was still pregnant at this time, and therefore I thought I will bring it today, because for me it was really a clinical challenge. This is a 35-year-old woman with mode 2 diabetes. She has a history of multiple miscarriages, but also a positive pregnancy, with giving birth to a girl in 2021 where she had gestational diabetes. And the girl was born small for gestational age. And actually, the girl had a growth retardation within the first 2 years of life. The woman has a genetically confirmed MODY2 with a low C-peptide and an HbA1c of 6.5% before pregnancy. Since she wanted to get pregnant again, she asked me to start insulin therapy in order to prevent hyperglycemia caused malformations. This is the AGP before pregnancy, and it's very typical for MODY diabetes that they have increased fasting plasma glucose. We started insulin therapy with a smart pen because I really wanted to learn her the best insulin injection behavior what I know. We set the range into the pregnancy range, and I explained her the difference whether she makes the injection, the bolus injections before the meal or after, because afterwards it can also lead to hypoglycemia. After that, she had a really good glycemic control, and as you can see here, in the 23rd gestational week, she used 16 units of basal insulin and 16 to 20 units of rapid-acting insulin. But suddenly, at the 26th gestational week, the fetus had a growth retardation despite normal blood supply. So we had to stop insulin therapy. And that's what you have to do because it's assumed that the baby also has MODY2 and needs higher glucose values in order to secrete insulin. Maybe you will ask, why didn't you do a genetic testing at the fetus? For that, we would have made a punctation. And the woman, after multiple miscarriages, doesn't want a punctation. So we just stopped it according to the ultrasound data. And despite stopping 30 units of insulin, she had a quite good glycemic control with 83% time in range and gave birth to a normal weight, normal glycemic boy in the 39th gestational week. I want to show you here that clinical cases can be really challenging, and we should take all the support we can get by CGM and also smart pens. And there will come more data also in this study, for one of the first studies showing data with smart insulin pens, showing a significant increase in time in range, decrease in time below range. And I'm sure we will be able to present you more data on smart pens within the next years. So to summarize, we have now the opportunity to connect the data of the continuous glucose monitoring with the insulin injection data, also in those who are using pen. We can work together much more better with our patients, with the people we take care of, as the devices work together. And which further devices work together will be presented by Emma now. Thank you for paying attention.